Hey, Lauren.
Hey,
Hello.
Lauren.
Hi. Nice to
How are
see you both.
you?
I'm doing great. How are you?
Good.
Welcome.
Thank you. I'm excited about this.
Glad you
Same.
could join us. I know you're busy.
I, it's so funny. No matter how much you plan, just plan on being surprised. That's the bottom
Yeah.
line. That's like my advice.
It's controlled chaos, really.
Yes, exactly. And it's still controlled, but it's the closer it gets, it's like, oh, okay. But the good news is it looks like we're gonna have a really full crowd. We have like 125 right now. And yeah, and they're mostly doctors, so that's great.
Yeah, that's a good meeting.
Congratulations.
Thank you. Yeah, I'm excited. Last year we had about 80, and then it came to like 100 with team members and things.
Yeah.
But it'll look very full because I like the half round tables, so you have conversation. So it's not just like everyone's in a line in their own little cubicle. So yeah.
Yeah. I'm excited just to be in New Orleans and out of Oregon in March.
Good for you. Have you been before?
I have not been to well, outside of New Orleans airport, just as a connecting
Oh
flight.
wow.
I've never been. So yeah,
Yeah.
I'm looking
Well,
forward to it.
what about you, Michael? Have you
First,
been?
it'll be my first time connected
Oh
through
my
the airport.
goodness.
Yeah.
Okay. Wow. And it's great. The Ritz is great. It's a great like home base to kind of get out of all the craziness. It's like shelter, it's like
Yeah.
step into like heaven, with your robes and everything.
I hear you've got to dodge the guys that are going to try to clean your shoes and clean your purse and
Yeah, you got to be very street smart for sure.
Oh,
yeah.
wow.
Yeah.
All right. No,
Yeah.
good, good tip. I'm gonna hold my jacket close with my wallet in there.
Yeah, there you go. Don't you'll see. You'll see.
Yeah.
It'll be like let me just change the name. You want to just change my name to Lauren
Whatever
Hakes?
whatever you're comfortable with. Yeah.
Yeah.
I
You just
think
change it to mine. Oh, can I change it?
yeah.
Uh-huh.
Oh, I don't think so. Escape. Hold on. Now, where is this going to go? This podcast or interview?
So we have it'll go to our list of doctors, and I'm not sure what percentage make up of our airway providers. We probably have what 6 to 10% of our list are airway providers.
Oh, great.
Yeah. Yeah. We have about 1,300 people on our email list right now.
Nice. Okay.
Yeah.
Perfect.
Well, Michael,
Okay.
do you
There you
want
go.
to
Yeah,
take it away?
yeah. I wanted to let her let me know when she was good to go. Oh, she's good.
I'm good to go. Yeah.
All right. Well, thank you for being here, and Todd, I appreciate you your sponsorship with Airway Palooza with Dental Sleep Profits. I'm Michael Hahn, Vice President of Dental Sleep Profits, Todd Warren, CEO and founder, and we're here with Lauren, founder of Airway Health Solutions, and we're excited to be able to just talk about Airway. We're excited to talk about just how you got into it. So we got some questions, and then I think Todd's gonna close us out, and we'll just keep this fun and informative and
Great. I like fun and informative. Two of my favorite things.
nice. So tell us about what inspired you to specialize in airway dentistry. I know you have a clinical background, and
Sure.
so tell us a little bit about your story.
Well, I'm a dental hygienist by trade. I graduated, I'm going to age myself here though, in 1991. And I was always curious, and I've always wanted to strive to help my patients the best I could. So, that evolved over time. If you think about comprehensive care, when you graduated, no matter how old you are, it certainly has changed its definition over time, right? So a lot of times we don't know what we don't know. So we think we're doing the most comprehensive work and offerings for our patients, but then all of a sudden you find out there's more and there's a bigger picture. And that's what happened with Airway. And it was pretty recent, actually. I didn't know anything about Airway until about 2013, 14. So later in my career. And I was so focused on the health benefits of proper occlusion, clear aligner therapy. That was like the newest shiny penny. And I didn't know that beneath malocclusion really lies the true causative matter of air or sleep disordered breathing, and a lot of the health consequences that are responsible because of sleep disordered breathing. And I didn't put together that we can actually help prevent sleep disordered breathing and help our patients who do have either it's mouth breathing, upper airway resistance syndrome, or even sleep apnea. We can help them in the dental chair. So once I found out, number one, we can help prevent it, my antenna really went up. But then we can also help our patients to understand the etiology of some of these problems that they're experiencing. And it's empowering. And I love to empower the patients. So I know it's a big question. I hope I answered that.
No, I think
that was really good. Yeah.
Yeah.
Thank you. Okay.
Yep. Yeah, I think what the goal was just to really share with the audience and obviously hear from you just what your passion was, and to be able to really kind of give a vision of a little bit of your journey. And in that regard, I think about if there was a dentist that was looking at getting into airway, they've
Yeah.
heard some publications, they've heard some speakers, they're not really connecting the dots. What would you say would be the approach to identifying potential airway issues in their patient, and what would be the on-ramp to be able
Yeah.
to kind of connect in a deeper way?
Well, it's funny when you say the on-ramp, once you have like airway goggles on, they don't come off, right? So there's no
Yeah.
off-ramp. Once you see it,
Yeah.
honestly, you're gonna almost like 99.9% of your patients are gonna benefit from some type of expansive treatment, just because of our society, how our jaws have shrunk over time, especially with the children. There's so much research on that through anthropology, not so much through dentistry. But I would encourage them to just visit our website, because we do have a lot of free education on kind of how we got here and what to look for. That's airwayhealthsolutions.com/chats. We can, there's so many different subjects there that I think the best way is to really understand how we got where we are, why so many people are suffering from sleep disordered breathing, whether it's obstructive sleep apnea. I mean, I can't go to a party, someone finds out what I do, I'm talking about CPAP to so many patients, people, as you said. But it's like epidemic, and it's epidemic for a reason. And it's because of, our Western society, and we don't have that soft food diet. And the good news is we can prevent this and turn this ship around. But what to look for? There are specific things that you can do that you're already doing in your chair. And this is a lot, mainly geared toward the hygienists when they're doing your oral cancer screening. You actually are doing an airway screening, you just don't realize it. So what I like to tell them is you already are evaluating the hard tissue and the soft tissue through your oral cancer screening. At that same time, put on your airway goggles, and you can really help find for some clues to airway disorders. So I'm a big fan of acronyms. I have one called NESTS, which is very easy to adhere to. The N would be narrow arches. So when you're looking for lesions on the palate, you're going to see if the palate is high, vaulted, V-shaped compared to a nice, beautiful dome. You're going to see that right away. So that's a clue. E would be the enlarged tonsils. When you have the patient stick their tongue out and you look at the back of their throat for lesions, you're looking at their tonsils. So just examine, are they kissing tonsils? That would be a grade 4, 3, 2, 1, all the way to open. That's easy enough. The soft palate, or the Mallampati score, would be the S. That's looking for the soft tissue kind of enlargement, where the palate's going down the throat, where it grows downwards. So the uvula, actually you can't see it anymore because it's down and back. So basically your throat is closing up, it blocks your airway. I'll share with you, I was embarrassed to say, but up until like 2013, I thought that when I opened and checked for oral cancer lesions, that if I didn't see the uvula, I thought they had their tonsils out. Like I didn't even know about a Mallampati score. Like it was never taught to us. So, we also have to be easy on ourselves as practitioners, that we don't know what we don't know because it wasn't included in the curriculum. But it's really empowering to find this information out, because it's more readily available now. But and then apply it to your patient's health. So that's that soft pot. That's an individual risk factor for obstructive sleep apnea. T would be for the tongue tie, meaning that the band of the frenulum here. If it's tight, you can see that pretty much right away. It's a 1 to 4 grade. If it's tied, moderate, slightly, you can really just do an evaluation. This is not a diagnosis. This is just an awareness.
Right.
A lot of clues would be if you lift the tongue and you can't get that full range of motion, it's a short frenulum and it's tied. The other thing would be if it's heart shaped, like dipped down rather than oval. That's another clue. And then lastly, and probably so popular, would be the scallop tongue. That's an individual risk factor, host factor for obstructive sleep apnea. And so many people have it just because they don't have enough room for their tongue.
Yeah.
Their tongue will go back. So that's my nests: the narrow arches and large tonsils, soft palate, that Mallampati score, the tongue tie, and then the scallop tongue. I have, when I was practicing, I made it in my notes and just clicked, check it off because you're already doing it. So hopefully that's my
Brilliant.
1 minute airway screening.
Brilliant.
Thank you.
Yeah, it's neat to see. It's neat to see that, it's not that difficult. You're, like you said, you're already screening for those things, and you're looking in people's airway, and it's not much more effort to make a note and say, hey, this is something we need to be aware of.
Yeah, that's why I call it it's less than a 1 minute airway assessment, because you're
Yeah.
doing it already. And I know as a hygienist, I worked in New York. I only had 45 minutes a patient. So I had to be very concise and multitask, and it can be done. It can be done.
Yeah.
Todd, do you want to I know I'm thinking about our audience. The scallop tongue is something that they're very aware of.
Yeah.
And I'm thinking about most of our dentists that are within our ecosystem are predominantly oral appliance therapy. They're doing amazing work and
Yeah.
we're helping them. Do you want to just take just a second and just kind of share with Lauren and maybe the audience just a refresh of what we do, and then we can jump back in with Lauren?
Yeah. I mean, between Michael, myself, and a couple other team members, we have over 35 years experience in the sleep space. And what we saw in the industry was there's a lot of cookie cutter kind of programs out there, and we wanted something that was very much tailored to where our airway and sleep dentists were at in their journey. Obviously we have programs designed for people who are just starting out a sleep or an airway program. We have programs where the goal for the dentist is to transition out of dentistry completely. And we work with over 100 offices in the United States right now. So we've got a lot of data. We know where the industry is moving. We very much have our finger on the pulse of where the industry is at. Similar with the airway, we work with a lot of airway dentists. So we get to see how patients are reacting to the information that they're being shared with. So it's really, really neat to be a part of that and get to see people's eyes open to the realities of the impact that their airway is having on their overall health. So I think more so than any other marketing company, we have access to so much of that data because of the number of dental sleep and airway offices that we work with. So it kind of puts us in a unique position. But I mean, with Lauren and Airway Health Solutions, getting to collaborate in that regard and just learn what basically you've learned, Lauren, I think it's an incredible opportunity for our clients to kind of glean from your experiences as well. So I don't know if that's what you were looking for, Michael, but that's I just think this is an incredible opportunity for our clients to look into, and for the audience that we have to also, if they're wondering if they should get into airway, I'm hoping they get a good idea from Lauren here, a better idea of whether that's something they want to pursue. I think it's a great idea.
Yeah. Lauren, do you want to just take a moment and talk about Airway Health Solutions? Is that appropriate?
Sure. I mean, I'm happy to talk about it, but basically it came from empowering the dental clinicians to really help their patients breathe, sleep, and thrive. I mean, it's really that simple. There is no greater joy as a practitioner to really help your patients live better lives. That's not just tooth focused. And what I love is the ability for a doctor to come in and take our mini residency. And then many times in turn, they either treat themselves, their children, their loved ones, and that return on investment is
Yeah.
priceless. I mean, you
Absolutely.
can't, that's where I get the goosebumps. That's where I'm like, okay, we can, it's just made my day, just that one person changing their lives. And we do have some spotlight series on our website, so you can hear from some of the practitioners how it did affect them. I'm a very soft sell in a sense that it's not like, oh, do this and you're going to have this much return on your investment. You will have a business return on investment, no doubt, because these procedures, dentists charge anywhere from $5,000 to $13,000 for an expansive case, depending on the degree of severity, or you can do more of them and not charge as much. That's their prerogative. But the beauty of it is really it's less drill and fill, it's more quality time, and you get more referrals for sure. I mean,
Absolutely.
the referrals, we don't even, there's in-office referrals that like, let's start there before we start marketing your practice, because when you learn something new, it takes time, and people are forever grateful. That's where the passion comes in, and that's where the appreciation comes in, where people are part of our alumni, that they feel like they're in a community that supports them and that they're really taking dentistry to the next level. So it empowers them, it empowers their patients, it empowers their community. It's just empowering overall.
I feel the passion on that, the inspiration on it. You're helping the helpers and giving them eyes to see. I love Dr. Felix Leals. He's like, once you said about the airway goggles, giving
Yeah.
them new eyes to see. The earth is no longer flat.
Yeah.
And when you see that, it's a whole new game, and they get set on fire that they're not stuck in drill and fill, to your point, that there is a frontline place for them in it's a real significant health issue. And it's a health crisis, especially with our kiddos, what you alluded to earlier about the underdevelopment of the jaw. And my own journey, 2002, I shared with you, a while back, on seeing Dr. Christian Geminal speak on Dr. Weston Price's material. And I looked and I saw my Sicilian mother-in-law, and I saw my wife, and I saw my daughter. And I thought, oh my gosh, who's doing this work? Who's helping? And here we are, 22 years later. Wow. And we're having, and we're seeing the groundswell of movement, education. It's a grassroots effort to educate with people like yourselves and Dr. Ben and so many people. So I want to respect our time, and I want to go through a couple more questions. Can you share with us a success story that's dear to you, that's just build on that inspiration that we're experiencing?
Well, I'm going to go through I have so many as a clinical hygienist, from detecting type 2 diabetes from the hygiene chair. I was featured on national television that she would never have realized that she didn't know she had type 2 diabetes, to get her sugar under control on the glucose from the hygiene chair. That was really empowering. But as far as when you said helping the helpers, that's what really empowers me now. It's because now we have 600 doctors who are in turn treating thousands and thousands of patients. And when they call me to thank me for their own children, for their spouse, for themselves, and they're choked up, there's tears in their eyes, it's beyond me. It's literally beyond me. And I just feel so happy just to help that one child, that one spouse, that whoever it is, they're the most important, because it's their life, and I had some kind of effect on it through our trainings and through our vision. So it's more of it's not one, it's the greater good of so many. That's really so appreciative now. I'll tell you a funny story is Dr. Scott Province. He practices in New York, and he took our adult mini residency because he doesn't see many children. And he just wanted to learn about clear aligner therapy, adult expansion, safe expansion using like a Schwartz type of appliance. And I said, okay, well, you may want to consider taking the pediatric one first, because that's just the natural progression. He goes, no, I'm going to hold off on that. Well, he took the pediatric mini residency, I think like 4 months later. I think it was in June. This was February. And now he just got his license to open up a pediatric practice in New Jersey because all he
Whoa.
wants to treat is children. And you know, it's so funny how he helped his children. He was actually our speaker at Palooza. We have our guest speakers who are actually dentists who took our program and to share their outcomes. There's not going to be a dry eye in Palooza when people see the passion and the outcomes of the teachings that were implemented for themselves, family ones, loved ones, patients, but everyone has a story and they're all great stories. So every story matters, but I love that full circle kind of story where I'm not seeing children. I'm like, okay, just wait.
That's right. That's
Never
right.
say never.
Yep.
And also the children, the results are so quick. It's so quick. And the younger you reach, we're now doing fix before 6. The younger you are, the faster the results and the quicker the rewards. So that gets empowering as well.
Oh, it's beautiful.
Yeah, one of those stories got me with one of our clients. We're doing a pediatric advertising campaign for them, and it was a 10 or 11-year-old daughter, and the father was just harping on her, thought she was seeking attention by wetting the bed every night.
Yeah.
And when our client explained what she was actually dealing with, he dropped to his knees in the hallway of the dental practice in tears, apologizing to his little girl.
Yeah.
And like I heard that and I was just like, this is a game changer for families.
Yes.
Oh,
Not just kids, like
yes.
yeah,
It's a family
the
affair.
stresses
Yeah.
that come along with
Mhm.
sleep disordered breathing in children, the stresses on the family, parents, the child themselves. I mean, it's just
Yeah.
incredible what can be accomplished.
And this isn't that new anymore. For instance, like the ADA, they have a brochure now on children's airway health that's, you know, talking about this, that we need to recognize this. The ADA had a call to action in 2000 and when was it? 2009?
22 or no?
2009, perhaps 2007. Around like I forget the exact year, but they had a mandate where like everyone has to screen for obstructive sleep apnea. It's their obligation in a sense. And I know we're working with the ADA now, Dr. Gerald Simmons and Dr. Kevin Boyd.
Carsonson.
Yeah, and Dr. Steve Carsonson. They're all working on these changes to make it, you know, mandatory and universal screening. So a lot of things are happening. They have their ADA conference in June coming up, pediatric sleep, and there's a lot of things that are pushing the needle forward. But you can't push the needle forward without pressure. You need pressure. So that's what we're trying to do, and pressure through education and empowerment.
Yeah,
Powerful.
great.
You talked about Airway Palooza. Let's spend the last couple of minutes we have. Talk about this amazing industry first event that you and your team have hosted, and you guys ideated this and brought it to life. Tell us about that.
It actually started with a dream. Honestly, I woke up and my husband thought I was crazy, but I'm saying I pictured the whole thing, an Airway Palooza, and this was in December 22 that it was launched. So this was like December 2021 where I had this dream, and I said, and James Nestor is going to be there, and he's, you know, the author of Breath, which every dental professional should read. And you know, he was so hot. He just sold his book, and little did you know, we had a sold out Airway Palooza 2022 with James Nestor as the keynote. But the goal is that it's a celebration. And there's a lot of pioneers here taking the road less traveled. And it's scary sometimes, you know, because you didn't learn this in school. You don't know what you don't know. And change is always scary. So I wanted something to really honor them, celebrate with them, everyone have that camaraderie and that just fun, you know, we just almost like a celebration, like a wedding. So everything's included. We go top shelf with everything. It's at the Ritz Carlton in New Orleans, March 15th and 16th. All meals are included, and they're great meals. That's the Italian side of me probably comes out where I'm like the hostess. My family my family is the event team. So it's very warm. It's not like a corporate event. It just feels different. It feels like a wedding of someone you really want to celebrate, you know, that you don't have to go to, that you want to go to. We have top shelf host bar, music. The socials are included. So that's why our ticket may be more costly than others, but we put a lot into the individual ticket. So you'll have a great time. And it's at the Ritz, baby. What else can I say, right?
I love
But
this. Go ahead, please.
I just wanted the caliber of speakers, the education is top notch. And that's almost a given because when you see who our speakers are in the airway industry, they are the top notch speakers. So like you said, Dr. Felix Liao is there, Dr. Ben Moralia, Dr. Kevin Boyd. I want everyone just to go because I literally have 20 speakers. So it's everyone coming together under one roof and everyone has key notes to share. Dental Sleep magazine written up as a spotlight feature, so you can check us out there as well. And they go through each day with each speaker and their topics, or you can visit our website, airwaypalooza.com. We are almost sold out, so I'm not just saying that. It's true.
Yeah.
It is true. So if you're on the fence about it, come join us. You won't be disappointed. And we will have we do have a virtual ticket as well.
Okay.
That is amazing. I loved how you described this, and you reset my whole frame of reference for what we can expect to come and supporting you and your team as sponsors. We're thrilled. I mean, the idea of a celebration, it's so exciting to us. We love a good party, but the idea of honoring, that's just a completely different, paradigm. And I just thank you. Thank you for doing it.
Well,
Thank
thank you for
your
supporting
dream.
us. Thank you. Yeah, I literally followed my dream. I knew it was bigger than me. And you're going to see, I got everyone last year to sing together. We all, so
Nice.
maybe another karaoke.
That was after the open bar.
Actually, it was the opening session. So
oh, wow.
yeah, so we're only up from there,
I'm excited for karaoke. Todd can sing. He's got a
okay.
I'm just kidding. I'm just kidding.
But we also have I don't know if you've heard of the Pulmonauts. We performed at Collaboration Cures. It's originated from James Nestor and his band, but they'll all be there and we're going to be just singing porch style at the happy hour. So
that's so cool.
Yeah, it'll be fun. It's a celebration, it's an honoring, it's a time and space where we need to put the pressure on to move the needle, and we're the pressure cookers, so to speak. So together we're stronger, and I do think we will make a difference.
Yeah, for sure. Yeah. And you said the event right now, there's around 100, or how many people registered?
So we have like 130, and we're going to cap it at 150. I cap it because I don't want it to be uncomfortable. I want everyone to have room. I like to have the round tables where everyone can talk to each other.
Yeah, no, that's going to be great.
Yeah.
It sounds like it's a great atmosphere, conducive to collaboration, learning. Yeah, I think it sounds like it's going to be great. I'm really looking forward to coming down there.
Thank you. We have medical speakers as well. We have, ENT, a sleep specialist, board certified sleep specialist, and a triple board certified neurologist. So we do have 3 medical speakers, as well as speech language pathologists, myofunctional therapists, and then airway dentists, pediatric dentists, orthodontists. So
awesome.
It's going to be something. And then day 1 is pediatrics, day 2 is adults. If you only want to attend one day, you can. Some people have time constraints. Just reach out to me. I'll be happy to help.
Beautiful. Thank you so much for taking time. You're busy. You're building up to this big event, and you took time out for us. Thank you. I appreciate you guys so much, and let's Palooza together. It'll be great. All right.
Awesome. Thank you, Lauren.
Take care.
All right, we'll see you. Thank you.
Bye-bye.